Hi, everybody. Robin Jones here, Chair of ROMA, and I'd like to update you on our June board meeting. So this month, we took the opportunity and held our meeting in the Thunder Bay area, and it was a great experience for everybody. The agenda was full, but it provided a lot of learning opportunities for the board. We first ventured to the community of Roslyn and learned about an innovative modular home design at Smart Modular Canada. This company is answering the call for housing by building modular homes and offices from start to finish in their warehouse and shipping them to rural and northern Ontario and beyond. So this is clearly a made in the North for the North company, and the experience was invaluable for ROMA board members. We are very grateful for them to take the time with us. Next, the board visited the Northwest Community Health Center and listened to an in-depth presentation about healthcare programming and services offered in Thunder Bay and area to their residents. Equitable access to services, specifically primary healthcare services, has been a core focus of the ROMA board over the past few years. So it was tremendous to have direct insight and conversations about healthcare with a local Thunder Bay provider. We had the pleasure of being invited to Fort William First Nation and the beautiful Anime Waju, also known as Thunder Mountain or Mount McKay. An amazing community elder spent time with us and helped us to better understand the traditions and history of the Ojibwe of Fort William First Nation. At the board meeting itself, Chloe Langlois, business advisor for OMAFRA, spoke to the board about economic development success stories in Thunder Bay. And in particular, Chloe sits on a board that developed the Thunder Bay and Area Food Strategy, which focuses on addressing barriers to accessing food and ensuring access to food during emergencies. The strategy is the first of its kind in Canada and is a community-led initiative with 9 primary partners. It's certainly a model for other communities to consider. We also heard updates from AMO policy staff regarding the Provincial Offences Act and important work related to access to healthcare services. They are in the primary stages of advocacy work that would call for the development of a sector-wide health and human resources strategy. You should hear more about these matters at AMO. So that's a wrap for now. Please follow us on Facebook, X, formerly Twitter, and most importantly, LinkedIn. By far, the most activity on our social media is on LinkedIn. So we cover important news and updates, and you can watch for information about the AMO conference over the next several weeks. So that's all I've got. Take care. Enjoy the summer.